Welcome to MD Conversation. This module discusses a type of imaging technique for the breasts called mammography. There are other modules available that describe other aspects of breast health. This information is taken from a recent review of the medical literature and attempts to be as transparent and comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or skip through them in any order you wish. Last year in Canada, over 5,000 men and women lost their lives to breast cancer. Despite it being the leading cause of early death in this country, breast cancer can be detected early and can be treated effectively. A woman's breast is composed of glands that produce milk, ducts that transport milk, supportive connective tissue, a nipple and surrounding areola, and fat, which gives the breast its size and shape. Most women experience periodic changes in the shape and contour of their breasts, such as a lump or lumpy area, a thickening of the breast tissue, an area that feels different, discharge from the nipple, indentation of the nipple, puckering or dimpling of the breast skin, a change in breast shape, or pain. Sometimes, a change in the breast can indicate a health problem, such as breast cancer. Although this will not be true in most cases, it is very important that all breast changes be investigated. For if cancer is found, the earlier it is detected, the better the chance of effective treatment. If you feel a lump in your breast or notice any other change in your breast, don't panic. If you are due to start your next menstrual period within a week or so, wait until after it is finished. Many non-cancerous lumps will go away by themselves with menstruation. If the lump persists after your period, see your doctor. The majority of breast lumps are not cancerous, but getting a doctor to check the lump can ease your fears. If it turns out that an area in your breast is indeed cancerous, by seeing your doctor early, you will be speeding up the process of diagnosis and treatment. For more information on breast abnormalities, please refer to the module in this series titled Understanding Breast Lumps. A doctor evaluates a breast lump by asking you your medical history, giving you a thorough physical exam, sometimes performing diagnostic imaging tests, and sometimes sampling breast tissue through a biopsy. Doctors differ slightly in how they address breast lumps, and each patient's situation is unique, but the general process for diagnosing a breast lump goes something like this. Your doctor will begin by asking you some questions about the lump and about your medical history, such as, when did you first notice the lump? Has the lump changed in size? Have you recently experienced injury to the breast? Have you noticed a change in the number of lumps you can feel? Have you noticed any nipple discharge? When was your last period? Have you recently been pregnant? Are you breastfeeding? Do you or your family have a history of breast problems, other medical conditions, or cancer? Are you on any medication, including hormone replacement therapy? And have you had a mammogram, another breast imaging test, or a biopsy before? Next, your doctor will perform a clinical breast exam to thoroughly investigate the breasts and surrounding area. The doctor will note the shape and size of the breasts, feel the breasts and armpits for any lumps or areas of thickness, and check the breasts for any skin or nipple abnormalities. You might need to raise your arms, place your hands on your hips, or lie down during this exam so that your breasts can be examined from different angles. The exam usually lasts several minutes. Then, to get a closer, more detailed look at any breast abnormality suspected, your doctor will likely recommend a diagnostic imaging test, such as a mammogram, an X-ray of the breast, and/or an ultrasound, which is imaging using sound waves. This presentation discusses mammography only. A mammogram is an X-ray of the breast used to locate and investigate breast abnormalities. Usually, the first test given to a woman with a suspected or known breast abnormality, depending on her age, a mammogram can also screen for unsuspected abnormalities in women with no symptoms at all. A mammogram allows doctors to visualize a lump too small to be detected by touch alone. In fact, it is estimated that mammography can detect breast cancer up to 2 years before it is discovered by physical exam. Therefore, a mammogram can help detect breast cancer at its early stages. The mammography machine is a device with 2 large plastic plates that compress, hold, and position the breast so that X-ray images can be obtained at different angles. Like all X-rays, mammograms do expose you to some radiation, though only a small amount. Mammography uses less radiation than a standard chest X-ray, and there is no significant risk of radiation damage to the breast. There are 2 types of mammograms: screening mammograms and diagnostic mammograms. Screening mammograms detect breast disease in women who do not have any symptoms and are performed even if monthly breast self-exams do not reveal anything abnormal. It is recommended that women get regular screening mammograms after the age of 40 or 50, depending on the doctor. Some women, particularly if they are at high risk for breast cancer, can have regular mammograms beginning at a younger age. Please consult your doctor for advice on when you should start screening through mammography. A diagnostic mammogram uses the same X-ray machine and takes at least the same number of pictures as a screening mammogram, but is performed when a breast abnormality has already been found, is suspected, or if a woman has breast implants. On the day of your mammogram, please do not wear powder, deodorant, lotion, or perfume under your arms or on your breasts, as they can interfere with image interpretation and cause confusion. Metallic particles in some deodorants, for example, can show up on a mammogram looking like calcifications, deposits in the breasts that sometimes signify cancer. When you arrive at the clinic or hospital, you will be given some paperwork to sign and will be asked to undress from the waist up and change into a gown. Please inform any doctor, nurse, or technologist present if there is any chance you may be pregnant. Overall, a mammogram takes about half an hour. An imaging technologist will first position and compress your breast between the 2 plastic plates on the mammogram machine. This pressure may feel uncomfortable, but it is necessary to hold the breast still and flatten it out so that X-ray beams can better penetrate the breast tissue. The technologist will know when to stop compressing your breast by feeling how tight the skin on the side of the breast is. But please, let the technologist know if the compression gets too uncomfortable. Once the breast is in place, a special camera takes 2 X-ray pictures of it, one from top to bottom and one at an angle. The process is repeated for the other breast, and the images are stored on film or sent directly to a computer. A mammogram is uncomfortable. To minimize discomfort, it may be helpful to schedule your mammogram at a time in the month when your breasts are least tender, for example, during the week after your menstrual period. If you have sensitive breasts, some experts recommend you slowly reduce caffeine intake for 2 to 3 weeks before your appointment. A mammogram can detect benign, non-cancerous growths, benign, fluid-filled cysts, dense areas of the breast, unique tissue patterns, small white calcium deposits called calcifications, and cancerous growths. A mammogram can suggest breast cancer if it shows an irregular dense area, a thickening of the skin, a lump with sharp irregular edges, a particular tissue pattern, or small particles of calcifications called microcalcifications. Mammogram images are interpreted by radiologists, physicians who specialize in diagnostic imaging techniques. Cancerous and non-cancerous growths can sometimes look the same, so the radiologist will have to interpret the characteristics of an abnormality to determine the possibility of cancer. The radiologist will analyze the images, describe any abnormalities, classify the abnormalities, and suggest a likely diagnosis. The radiologist's report of all findings and comments will then be sent to the doctor who ordered the mammogram. Mammography findings can be classified by number where 0 indicates a need for additional imaging, 1 indicates no abnormality found, 2 indicates a definitely benign abnormality, 3 indicates a probably benign abnormality with a less than 2% chance of cancer, 4 indicates an abnormality suspicious for cancer, 5 indicates an abnormality highly suspicious for cancer, and 6 indicates a known biopsy-proven cancer. Depending on the radiologist's interpretation of an abnormality, you may need no further testing, or you may be asked back for more mammograms, a follow-up mammogram a few months later, an ultrasound, and/or a biopsy, a sampling of breast tissue or fluid. Additional testing doesn't necessarily mean you have anything to fear. Please discuss your mammography results with your doctor. As with any medical procedure, mammography is not perfect. A mammogram can miss, overestimate, or underestimate a breast abnormality. While a mammogram may show a lump, it cannot always distinguish between a benign lump, a cancerous lump, or a fluid-filled cyst. Also, the accuracy of a mammogram can be affected by the density of the breast tissue, which varies among women and tends to be greater in younger women. And mammography images can also be distorted by previous breast surgery or breast implants. In other words, not all cancers of the breast can be seen with mammography. Nevertheless, mammography is safe, quick, accurate, and has been used for over 30 years. Mammography can often determine with a high degree of accuracy if an abnormality is cancerous or not. Ultrasound, a diagnostic procedure that uses high-frequency sound waves to create real-time images of inside the body, can supplement mammography. For example, ultrasound can detect non-cancerous fluid-filled cysts with 100% accuracy, allowing a doctor to rule out cancer immediately. Ultrasound may also be recommended for those women with denser breast tissue when there is a palpable lump that is not seen by mammogram. Often, a mammogram and ultrasound give the doctor enough information about a breast abnormality to confirm it is benign. In some cases, however, it is not possible to tell from imaging alone whether an abnormality is benign or cancerous, and to make the distinction, a biopsy is required. A breast biopsy is the removal of a sample of breast tissue or fluid to be examined under a microscope for signs of cancer. Even if an abnormality already appears to be cancerous, a biopsy will simply confirm the diagnosis, speeding up the process of treatment planning. For more information on this, please refer to the module in this series titled Understanding Breast Biopsy. To summarize, a mammogram is an X-ray of the breast that can both screen for and diagnose breast abnormalities, sometimes long before physical examination can. A mammogram can feel uncomfortable and may not be suitable for all women, but mammography is a quick, safe, and accurate diagnostic tool. Other modules in this series include Understanding Breast Lumps, Understanding Breast Biopsy, Breast Imaging through Ultrasound, and Breast Self-Examination. Here are just a few of many resources available to educate you on breast health, breast cancer, and breast biopsy. These resources may also assist you. We sincerely hope that this module has furthered your understanding of breast imaging using mammography. We wish you the best for the future, and thank you once again for using MD Conversation.